Hello students, this is Dr. Ways and welcome to your lecture on lower limb movements. So in clinical correlations, we'll be practicing passive and active range of motion movements for each joint. So we'll talk about what those movements are here and then practice them in the lab. So for now, we'll start with where the center of gravity is for the body. And notice it's right as standing in anatomical position, it's right here in the center of the pelvis when you look at it from a coronal view and from a lateral view. And so specifically, it's in the second sacral, because remember the sacrum is made of fused bone, so it's in the second sacral bone. And highlights that one of the functions of the lower limb is to support the weight of the body. So if our center of gravity is right here in the pelvis, then it's the lower limb that is responsible for supporting the weight of the body. So also notice that the center of gravity is slightly posterior to the hip joint, anterior to the knee joint, and right in anterior to the ankle joints, with the toes in front and the heel in the back. And so this is the natural posture for a human when they are standing up. And notice that all the joints are in extension. So the hip joint is in extension and the knee joint is also in extension. If a reflection, it would come back this way and the hip joint would come up this way. And so the way that these bones are arranged is to make sure that weight is distributed evenly, allowing our posture to remain in an extended position. All right, so as far as the movements of the hip, we'll start with the hip. So natural extension right here, if we move the hip forward in front of our body, that's flexion. If we move it back to the center of gravity, that's extension, and technically going backwards like this is hyperextension, although it can be argued that from the midline point of gravity that just going backwards is an extension movement. All right, looking from the coronal view, if we take the entire thigh and leg away from the body, that's abduction. If we bring it back to the midline, that's adduction. In other words, adding it back to the midline of the body. And then another movement that we don't think about, if we keep our legs static and bend our torso this way, that is an abduction of our pelvis with our femur in a fixed position. So abduction of the pelvis this way, and then going back to midline would be a deduction of our pelvis. And we would do the same for the opposite side as well. So we mentioned this with some of our muscles that are within the pelvic region. We have internal rotation, which is rotating toward the midline of the body anteriorly, or rotating our hips toward the groin. And external rotation would be rotating away from the midline, or rotating towards the dorsal side of our body. And then of course, if we can also take our hip, it could be with leg bent or leg straight, and move it around in a circle. That is what we would call circumduction. And what that does is it kind of adds flexion, abduction, extension, and adduction, but collectively it would be called circumduction. And you're going to see that specifically with ball and socket joints, like the hip. All right, knee movements. Remember we said the knee is a hinge, and so in the normal extended version, it would be straight up and down. If we bring our leg back, we consider that flexion. If we bring it back, that would be extension. And we don't generally go beyond that center of gravity line with the knee, so we don't really do hyperextension of the knee. As far as the ankle goes, remember the ankle is also a hinge joint. And so when we bring the toes up toward our face, that is called dorsiflexion, because this is the dorsal side of the foot. And when we bring our toes down towards the ground, or go up on our tippy toes, that would be what we call plantar flexion, because this is the plantar side of our foot. So dorsiflexion, plantar flexion. Notice we're avoiding the word extension when we talk about the ankle, because there is no clean way of talking about extension. So we refer to it as the direction that the toes are pointing. So one of the things that you will be doing in your physical exam lab is having your patient walk across the room from you and then walk back, and you're going to observe their gait. And normally you refer to the gait as steady if you don't see any wobbling side to side or front to back. But what you should typically see in a normal person is one foot extending, the other foot going backwards, and the pelvis is going to follow a slightly wavy line as it moves. So a slight vertical shift in the center of gravity as your pelvis is moving. And the reason for that is when you bring your foot forward, you're actually tilting your pelvis slightly forward. And then when you bring the other foot forward, you're going to be tilting that side slightly forward. And when you do that, and you bend your knees slightly, that's going to allow you to raise your center of gravity up a little bit, then bring it down when you come down, and raise it a little bit and come down. So not only does it go up and down, but when you look at your gait, your pelvis is shifting to the right, and then shifting to the left, shifting to the right, shifting to the left. And so that's what these pictures are showing you down here, is that slight flexion in your knees. And when the knee is then extended, that's when your hips would move up, creating that vertical shift in gravity. And then your pelvis will also tilt, as we showed right here. And what that's going to do is minimize the rise in the center of gravity so you don't go off balance. So whether you're standing or whether you're walking and your gait's steady, muscles that you aren't even using directly to walk are adjusting constantly to keep your center of gravity at a roughly even level to avoid going off balance.